This is Dr. Dave Harper from M.O.S.A.I.C, and the topic of today's video is going to be headaches and migraines. Now these are two different types of headaches, but they both involve pain across the head. Sometimes there might be difficulties and challenges with visual disturbances. There may be nauseousness or vomiting as a result. You may have to actually find yourself in a dark room. That's more of the migraine type of perspective. And then the headache is more of the pain that can come from the back of the neck up over to the eye. It can be pain behind the eye. It can be pain across the temple area and through here. And it's very important to have a very, very good diagnostic examination to identify all different potential realities. If we're talking about migraine, it can be more potentially food related, so there could be a detoxification slash chemical sensitivity or gut kind of influence. There could be a hormonal influence to it, because sometimes headaches seem to come around menstrual cycles for women. These things are all important things to look at, so make sure that when you're thinking about your condition, you're thinking about when you're having them, what's triggering them. Is it a food that triggers it? Is it something in a particular type of food? Is it MSG that can sometimes trigger migraines for some individuals? And these things are important points and conversations to have when you go and get checked out to find out what the source of it is. But one of the things that I've learned in over 26 years in practice is that rarely is one thing the cause of a problem. And with migraines and headaches, this is where we begin to see this concept played out. Because to be honest, when the head and the neck, there's so many structures and so many issues. There's blood vessels and nerves, and there's muscles and joints and things that can impact the way in which the head sits on the spine, the way in which the spine has to move and articulate with each other. And these things are really significant as it relates to how they begin to accumulate together. In one of the other previous videos, we talked about the carpal tunnel syndrome and how the crush in the shoulder can lead to the elbow, and how there can be an accumulation of it. And then this is another one of those types of conditions that you really want to begin to try and tease out what's going on, because there may be 4 or 5 different things, each contributing 20 or 25% to the overall condition that you're presenting with, and you're looking for that one thing to blame as to, I have a headache because of this or because of that. It could be then where you might have some cervical spine challenges, because the alignment of the neck, the way in which the neck has to relate to turn, can be contributing to the way the muscles are compressed at the back of the skull, that then can lead to a food sensitivity issue or something that might be related to that. And so all of these pieces of the puzzle are what make migraines and headaches of all natures, of all types, cluster headaches or stress-related headaches. It can make them all sometimes fairly difficult to find out what is one thing, and you need a creative individual who's able to have a lot of tools in his toolbox, like we do here at M.O.S.A.I.C, to begin to try and understand what the difference is from one to the other. So if you have a migraine headache or a headache of any form, call the number at the end of this video, make a consultation with me. They're always complimentary to talk to me, and let's have a talk about what might be going on with you and begin to try and uncover and decipher the cause of the problem and not just mask the pain. It's all about living a long life well, and so give us a call at this number at M.O.S.A.I.C, and I look forward to your call and I look forward to our consultation. Take care.